But first, can we talk about the two questions I posed in two videos earlier this week? And the first, these questions came out of a conversation I had with a doctor that I respect very much. I respect very, very much. I believe in what he does and how he does things. We do not always see eye to eye on everything, but I don't see eye to eye with anybody on the planet. And I don't think you have to be eye to eye to respect each other and have a working relationship or a friendship. That's just my opinion. So the first question I'd asked earlier this week was, if you were searching for, and this is specific to pain patients, chronic pain patients, if you were searching for a new pain doc, and Doc A had all these accreditations, superstar, rock star, but he said, "I am David Smith, pain interventionist." Or Doc B had the exact same, he's like Dr. A's twin, has everything that matches. He says, "Hi, I'm Dr. Jones. I'm a pain management specialist or a pain specialist." Would it make a difference to you? What does the term pain interventionist mean to people? And admittedly, I think some of that response, and if you have an opinion, please put it in the comments, because what I'm gonna do is I'm gonna send this doctor the link to this video once it gets put on YouTube, because I told him I was going to do it. He said, send me the link because I want to hear what people have to say, because he's thinking about switching to a pain interventionist. Now, in this doctor's case, I understand it because he is in his practice. He has a former Texas Ranger strength coach as his director of physical therapy. He has imaging on staff, not on staff because you can't have a machine on staff, but imaging available at the clinic. Has a nutritionist available to you. He works with people and doctors who specialize in allergies, and then he works with all the regular like neurologists and stuff like this, to work on because he really, as he says, doesn't like to mask something. He wants to find the root cause.
Yeah.
Okay. Hey Kate, hope you're having a good night tonight. So the problem is, I think with a lot of our community in the invisible community, a lot of us are going to be skewed because we've had negative interactions with those that have called themselves interventionists. Me, Dr. Israel Pena, Granbury, Texas, now Fort Worth, Texas. The day I walked in and he had gotten his new uniforms in with Dr. Pena, pain interventionist, I about threw up, because he didn't suggest physical therapy or dietitians or acupuncture or diet or anything like that. It was all one thing, one solution fits all. And I think a lot of us in the community, we run into that. Mm-hmm. And we had some good ones that I want to read real quick, y'all, and I'll be very, very quick. But when I send this video to him, it won't have comments from the other videos on it. So we have like... Anthony said, "I dislike pain intervention docs. The VA is currently sending me to one, and I'm stuck at a certain pain relief because the procedures are no longer effective," meaning that the injections don't work, and that's all this guy will offer. What else? Was another one. Cass said, "Specialist in management. For sure, interventionist is about procedures to me." Yeah. Dixie said, "In my experience with helping others, I've learned quickly you don't want anything to do with those types, aka interventionists. I've not seen one yet who's truly helped someone. They usually cause more harm. Just my opinion." Kate, injections. I think injections are procedures. No discussion of meds or other modalities. Sarah, intervention to me can indicate something negative. Maybe that's stereotypical, but what is it? Why all the titles? You're a doc or not? And Jessica said, a salesman for their gimmick, money making.
Yeah.
Which is exactly what Dr. Pena was. So, I mean, does anybody have an opinion? If so, let me know and we'll get it up tonight. There's actually a study done on this. I know everybody out there is like, oh my gosh, Keith found another study.
Love it.
I did. It was printed in the the Clinical Journal of Pain. Is who published it. It was entitled "Patient Experiences and Satisfaction in Interventional Pain Management: A Multi-Center Study." Came out in 2021, so it's recent because this term interventionist just came back, right? Oh yeah. If you guys can smack my face, please, so we can get to 15.5, so we can make the FIP page. I'd love you for it. So the study came out in 2021. They studied 1,200 patients that had gone to different, completely non-same owned facilities. Like they went to Dr. Jones and Dr. Bob and Dr. Tammy and Dr. Steve, all different clinics. The one common denominator was they were all identified themselves as pain interventionists. 1,200 patients, all these different facilities. So it's not just like all owned by Granbury Hospital here where I'm at, which is a crappy hospital. They found that only 58% of the people of those 1,200, only 58% felt satisfied with their treatment and care at the interventionalists. It said, the study said many were unhappy because the pain relief didn't last long, like a nerve block didn't last long, or the steroid injection didn't last long. They found that those doctors didn't explain things clearly, or even worse, felt that they were pushing procedures without understanding their risks and options.
Yeah.
So I thought that was interesting because that's not necessarily as biased as the Invisibles here, you know. So
Yeah.
And
I mean, I think I echo a lot of what other people said, is that interventionalist, you think procedures, because that's really what they are. And I think, for me, titles are more than just a title. It tells you what you do. And because interventionalists, they do procedures. Like that's what they focus on. That is what they do. I have met one pain interventionalist who was okay with prescribing medication out of all my years. And that's just like, that's why titles I think mean so much, is like when you hear an interventionalist, you think of injections, you know what you're getting into. When you go to a specialist, you know what you're getting into. When you go to like a chiropractor or an acupuncturist, that's why titles I think mean so much. But yeah, I mean, interventionalists, I remember when I lived in Texas, I went to a pain interventionalist and a pain specialist, because one guy I went to for injections and he refused to prescribe medication, and the pain specialist I went to for the medication. So I had to go to two different people to get what I needed, because the interventionalist would not prescribe medication, but the specialist was okay with me. He knew about the interventionalist and everything. And so like I had to go to two places when I could have, if you would just prescribe the medication as well, it would have been a lot easier for me. But you kind of have to play the game that we're all playing.
Yeah. And Mom Douglas, oops, it just jumped. Where did it go? She had a good comment and it's gone. I lost it. Mom Douglas says, with all he does in-house, that name change seems okay to her. If he didn't, I would second guess going. So, yeah. Which is right. I don't have an alternative to him. I guess I'm looking at it as a PTSD fatigued person. Mm-hmm. And I was negatively impacted by someone who misused the term interventionist.
Yeah.
And that's, for me, is just why it's such a hard no. And this guy is such a good, not just doctor, but person. He can really help so many more of us that have this PTSD.
Yeah.
And I don't want those people to be scared off. But I don't have a good solution, a good alternative for him, because he does offer all that.
Right.
So, and offers alternative medical stuff,
mm-hmm.
Which he fits it. Mm-hmm. But I'm just, Leslie said, just the word interventionalist triggers me and brings back trauma.
Yeah.
I think
I feel like a lot of people can relate to that. You know, I've been in this pain world for 20 years now, and I ran the gamut of injections. I did them all. And now when I hear somebody saying, I'm going to a pain interventionist, my first thought is to tell them, okay, be careful, do your research, you know, look at what the injections, don't just blindly go in, don't just do whatever, like do your
Yep.
research, please. Because, you know, my spidey senses go up when I hear interventionist. I'm like, oh, okay, we're going to be pushing injections, we're going to be doing procedures, we're going to be doing all these things, which for some people works. And if it works, great. But sometimes that isn't the only thing that you need. Or if you're like me, the injections didn't work at all. So
Yeah.
I need somebody else.
Yeah. And I don't have an alternative for him because he really fits it, and I get his logic. But I'm just afraid that good people, as in patients, are not going to get the care they need from a doctor who is really willing to bend over backwards in a lot of ways, and because they're going to see that turn. And so, just a fear of mine. Real quick, the next question I asked is if you could offer one or two pieces of advice to your current specialist, whatever it is, neurologist, POTS doctor, whatever, you know, what doesn't have to be a pain specialist. What would some of your stuff, what would you say? And he didn't really ask for this. I'm just kind of throwing it out there to him because I think he's that kind of a guy. Stacy Snyder said, I wish he looked at me as a whole person. In her case, CPRS is so much more than just pain, and he often dismisses any other symptoms. He will also say it's unrelated to the CRPS. Meanwhile, in other support groups I'm in, over half are having similar experiences. Yeah. I just wish for once he would sit in a support group, sit back and just listen. You know?
Oh, yes. Girl, yes. I wish every doctor had to sit in a room full of his patients and just listen to us talk and listen to our experiences, because I love that comment.
I don't think it needs to be his patients specifically, but that would be nice,
just
right?
Like, you know, patients.
Just patients in general. I think in a lot of cases, these doctors know. Mm-hmm. And I guess the problem is, how do you force bad doctors to sit there and do that? Right? Because that's going to be, I have a doctor, I'm blessed, that listens to me, that will, cripes, this last appointment I was at, I have my list, right? I mean, this right here, things I wanted to talk about, right? And we blew through all 5 of those in like 10 minutes, including a possible med change or increase. And that wasn't, he reworked it to help out, right? A new medicine to be added, the ketamine, right? And then for another 15 minutes, we talked about life.
Yeah.
You know, how was I? How am I doing? You know, what's working? What's not working? How's this stress from this situation in your household affecting you? Is it getting any better? And he actually listened. And it wasn't just him. It was him, his PA, and a student they had him at the same time.
Oh, wow.
So, and the listening is very, very common. Ricky, Declining Spine, said, the number one thing that automatically makes me frustrated is when the doctor doesn't fully listen. Yes. And just like Sarah just said in the comments here, building trust through building relationships. That's it, right? It's like I've told my pain doctor that I'm softening on the nerve stimulator. I'm not there yet, but I told him I'm softening, but thought I was going to have to pick him up off the floor when I told him that. Shelly, who I love, Shelly is one. If you're not following Shelly, you need to. Former retired nurse, just a great person. Unfortunately, deals with chronic pain. She said, really listen to your patient who's an expert on their own bodies. Acknowledge they've been traumatized by other medical staff. She also said, keep pain management specialists. Pain can be managed, but not always cured for chronic.
Oh, absolutely.
Well, we just got restricted again.
Lovely.
Yeah.
I feel like we didn't even do anything this time.
I don't think we did either. So just says standards of community guidelines. Oh, we discussed drugs again.
We did?
I guess prescriptions.
Oh. Yeah. Whatever.
Anyway.
Right. But
anyway.
Yeah, I agree. Like, listening is such a big thing. But for me, like, I think listening is important. But also with listening, I need them to be open-minded.
Holy crap. You know what? I just realized.
What?
We got the live restricted because of drug use. And then we got a live restricted because it contains themes some may find uncomfortable with and has been restricted. Regulated goods content. That's a new one.
What does that mean?
It means I got two restrictions tonight. Congratulations. I'm an overachiever.
Of all the times to get restricted too. I'm like, what are we even doing?
Yep. Carol said, patients are not their chart. Patients first. Think outside the box. I love that one. Yeah. Kate suggested more appointment availability. I need a doctor now. I can't wait 4 months. Valerie went initially it's going to be 13 months, right? You know what? Why we may have gotten reported? Why? I think it's that minister from earlier today.
He's mad at you.
Yeah, I think so.
Yeah, we'll keep on.
Yeah. So yeah, I think it was. I have more of the comments here, but I think listening was like overwhelmingly the number one. And the second, or if not number two, type number one was be more willing to prescribe meds.
Yeah.
But
I think just having a listening ear and somebody who's willing to work with you, whenever years ago, I had met with a doctor and I remember him sitting there and he sat and listened and he gave me his idea and then he said, but what do you think? What do you want to get out of this? If you could be your own doctor and do whatever you wanted, what would you do? And I told him, I was like, well, this is a medication that I've been taking. I don't feel like it's working. I've researched this, and this. And he goes, okay, I think that's a great idea. Let's try it. So it's like, not only did he listen, but he had an open mind, knew that I know my body better than anybody else. And he was willing to work with me. And that to me, I was so sad when I had to leave Texas because I was like, can I move you with me, sir? Can you come with me? But I think there was nothing else great about him. But he just listened and was willing to try things and treated me like a human. And it's kind of sad that that's all we really care about. But that really is, I think, such a big basis of it is just somebody willing to help.
And I'm going to, all right, is everybody sitting down?
Uh-oh.
I'm going to stick up for possibly doctors who aren't that good.
Yeah.
And what I'm going to say is it is such, I don't want to use it to say profit-driven thing nowadays, but it's such a, it's a money thing for some doctors. And if they spend, like my doctor did that day, spend 40 minutes with me, that's another patient he could have seen and could have billed.
Oh, absolutely.
Right.
Oh, yeah.
And a lot of the time for a lot of us, like when I was in Vegas, I saw my pain doc twice a year.
Mm-hmm.
And that's it. And the rest of the time it was a PA.
Mm-hmm.
And so I get it.
Yeah.
But it's that acknowledgement, 5 minutes, 10 minutes of acknowledgement.
Mm-hmm.
Really, especially for a patient that's got PTSD, medical PTSD. And unfortunately, my personal doc has seen my medical PTSD when he gave me that EEG test about 6 months ago. And I totally went ape. My mind was going in dark places, and it's like, I don't want this. I don't think it's necessary. Why are we doing it? And to the point that the poor woman that was giving me doing the test went and drug him out of a meeting to bring him in to talk to me.
Yeah.
Right. And even after that, he didn't fire me, you know? So, but I think if somebody's got an ounce of medical PTSD, 5 to 10 minutes of acknowledging, you know,
and
really.
You're right. He said it's hard to get a doctor to spend more than 15 minutes on a visit. And I get that, you know, like I worked in healthcare, and we would schedule patients on patients on patients. Like I was a physical therapy assistant, and we would schedule the patients for 45 minutes or an hour. And they had to be done because we had 1 or 2 more people coming in right after. And if we got behind, we were screwed. And it's like, I understand the mill of pumping people out. The more people you see, the more money you're going to get. But I think it's making that 15 minutes count. That would be such an improvement for me. Like, I understand you can only spend 15 minutes with me. That's fine. If those 15 minutes are you locking in and listening and being attentive and wanting to help, I'll take 5 minutes if you're fully in. You know, I think I understand the business of it. But I think even with the business side of it, there is still a place that the doctors can listen and be one-on-one and provide that security that we want and need. You know what I mean?
Yeah, I think an untold benefit to doctors, if they're able to do that, is what I told my pain doc when I just saw him last week. I'm softening towards a nerve stimulator. Because it helps build up, like Sarah said, the trust in the relationship, right? And I still don't want one.
Right.
But I think we're going to end up to a place that's going to be my final thing.
Yeah.
Casey says she goes to a hospital that has a pain management group that works with you solely in the hospital, and they've seen her. That's good. Says Taylor, I think we're settling with surviving instead of thriving because good care is hard to find now. That is so true.
Yeah.
That is so true.
And I think Sarah said earlier when I was talking about that, she said that shouldn't be a priority of like getting people through. But as much as that shouldn't be a priority, I think that's just the reality of it. And that's not going to change anytime soon. Insurance screws over doctors so much already that for them to get paid, they have to funnel people in and out. And it sucks. And I think, you know, Robin's right. We are settling for a lot because good care is so hard to find, because that's just how the system works. That's just how the system is. And like I said before, it's just a game that we have to play, and we don't always know the rules, but
yeah,
the game.
Because you got to know the rules to play the game, right?
Right.
And
we don't know the rules of this game. We have to figure it out as we go along.
Yeah, which sucks, you know. And I get it, you know. I'm gonna again speak up for the doctor I talked to. He told me about the umpteen times a day his office will get calls, and it'll be before they even ask if they're taking new patients. It's, does Dr. Jones prescribe this, because this is the only thing that works for me.
Yeah.
How do we present ourselves as the victim in the situation if we're calling or asking that question? Right?
Yeah.
So we stress all the other things that we've talked about in lives before. Your 2 to 3 minute speech, the SPAR, the listing out what all the things you had done to you and what has worked and what hasn't worked. Willingness to walk in and telling the doctor you're willing to try just about anything. Walking in with realistic expectations. If you can get me to a 4 or a 5, that's all I need. I can get my life back at that number, right? But if we're calling and before we say, hey, so you taking new patients? Hey, only this works for me. He doesn't script it? Okay. See you, bye. And I think we need to sometimes work on ourselves. So I tell so many people all the time, we can prepare our best and we can present ourselves and our case really, really well, and we can find a bad doctor still.
Oh.
And we can get crapped on by the medical system. But you know what? The difference is you can walk out of that office knowing you did right, and that the fault wasn't yours. And that to me is peace of mind. It doesn't take the pain away any, but it's peace of mind knowing that I'm not the one that jacked this up. It was Dr. Pena.
Yeah.
You know.
You said something that made me think of something that I had a lady reach out to me, I don't know, a week or two ago, and we had been talking back and forth, and she was having a hard time finding a doctor that would prescribe a certain medication because she said, that's the only thing that works for me. That's the only thing that works. I can't find anybody to do this. And she was really having a hard time. And I said, well, what else? Like, are you willing to try other things? And she said, no, because this works for me. And, you know, I just encouraged her. I said, maybe like you haven't tried the gamut of everything, right? Probably nobody on this planet has. But if you can find a doctor that maybe won't prescribe that one thing, but is willing to try things, you have to be, at some point, you have to be open to trying things. Even if something doesn't work, something else may work. You haven't tried it, you don't know. And the trying things is scary, especially if you have something that works. You don't want to let go of something. But, you know, something I've learned along the way is that something better may be out there. Something may work better. And you just don't know until you try. And I just, you know, I don't have all the answers. I don't know everything. I don't know a whole lot, usually. But I do know that if you don't try, you'll never know.
Yeah.
And so when you said that, that just made me think of that.
Yeah. That fight against those injections. Anyway.
Do your research.
Do your research.
Do your research.
But when you do your research, stay off the radar, and because remember, some specialists, regardless of their speciality, hate educated patients.
Oof.
So
I've met many of those in my day.
Like I wouldn't recommend going, hey, WebMD says I have this.
Yeah, never bring up
what kind of test?
Or ChatGPT. Just don't tell them where you got it. Just say you read somewhere.
So,
I read in a book. That's what I tell people sometimes when I like search things on ChatGPT. I'll be like, yeah, I read in a book that this is this. And they're like, oh yeah, totally. I'm like, just believe me. It's fine. Don't ask questions.
Okay, hang on. I want to ask Gen X Gypsy. The question that I'm reading that you had was, I lost it. Hang on. Answer what it's at when we've done nothing, just rested. Do you mean like why are we still hurt, or why are we still sick when we just rested, or go a little bit more, and I'll be glad to try to answer. Pardon me, I'm a definitely fame frog.
What?
Brain fog, just a hair tonight. So,
listen. Yeah.
But I dressed up. Look, to hair tonight. So,
listen. Yeah.
But I dressed up. Look, I have a clean T-shirt on. I have clean socks on. Because I got to send this to this doctor, and I wanted to look presentable.
I did not dress up for you guys. I'm very sorry.